This morning, here I am sitting in my car doing this because I live in very rural upstate New York and my building has very, very poor service. So we have been troubleshooting and hopefully this works out great for everybody. Oh my gosh, I'm seeing people hop on already. I'm so excited about this. Just got to get doctors on to be able to begin, but oh my gosh, we're already up to 7 people and it hasn't even started yet. I love it. Happy Endo Awareness Month to anybody else that's on here right now. Let's just see. There we go. They should be jumping on any second. Sorry for the lack of professional space for anybody who is just logging on. I get very poor service in my building, so we make it work where we can make it work. Just waiting for the doctors from New York Gynecology and Endometriosis to join us. I know that I have been talking up Dr. Singhal so much, and his partner, Dr. McLean, will also be here. Dr. Singhal is, I will start that introduction for him just because I know all your time is very valuable while they get logged on here. He's the founder of New York Gynecology and Endometriosis and Surgery in Bayshore, New York. He has 25 plus years in the field of gynecology and robotic surgery. He is world known for the work he does in the endometriosis community and the gynecological side of that as well. He's board certified gynecology surgery as well as board certified to be able to perform endometriosis surgery as well.
Hi. Good morning. How are you?
I'm doing well today. How are you?
I invited Dr. McLean also.
Hi.
She's here with us. So
I was just giving a little background on your credentials and what led you kind of headed towards developing New York Gynecology Surgery and Endometriosis. So I kind of gave your background of 25 plus years of board certified surgeon in gynecological field, robotic surgery. And if you guys want to talk a little bit more on what made endometriosis something that you guys wanted to special in when opening this practice dedicated to it.
So our journey started. I was employed by Catholic Health System of Long Island as the chairman of the system. And we had started what we call GIA Center of Long Island as a natural reproductive restore normal health. That was in 2016. And part of the journey, we started to experience a lot of patients who were asymptomatic and were not able to get pregnant. And I would operate on those patients, and after that, they were able to get pregnant. That was very intriguing for me. And since 2016-17, the more we started to understand endometriosis, the more surgeries we did, and we recognized this is such diagnosed, undertreated condition. And that was a natural progression. So since 2017, we launched our endometriosis journey. And the more we do, the more we understand, the more we realize what is in need. It's such a disease that very few people understand and have the experience to be able to handle this complex process.
Absolutely. And I was just sharing with them, I was hoping to do this in my, professional office, but I live in upstate rural New York that has very spotty service. So my car, but that just kind of goes to say too, the specialization and the need for people who understand this treatment to become broader and wider. I travel, you know how traffic is. It depends whether it's a 4.5 or a 7-hour trip when I make my trip down. And it's so worth it to go to Dr. McLean and Dr. Singhal because I had looked for years and years. It took over a decade of my personal symptoms before anybody really took me seriously. And there are places out there that are specialists for endometriosis, but that also comes with a large out-of-pocket fee. And you guys have been phenomenal about making equitable and accessible endometriosis care. And I think that's something that really sets you guys apart, is making sure that women's health comes first, not giving a substandard treatment just because insurance will accept the ablation. And that's actually one of the questions that a lot of the viewers and followers had asked was, I cannot afford the excision price that so many people are offering. Is ablation acceptable if I can't? What are my treatment outcomes? And I think a lot of that is hard to answer because it's case by case, but if you could speak to maybe the difference between ablation and excision.
Right. So I'll answer your question, like your journey. It takes years and years and years before a woman is able to get proper treatment. On average, it takes about 8 to 12 years before they are able to find someone who takes them seriously and get proper treatment they need, whether it's surgical management or medical management. When you talk about surgical management, the gold standard really is excision, because ablation is considered substandard, and with ablation, keep in mind is once you ablate those lesions, it creates a lot more inflammation, a lot more scar tissue formation, and it really does not destroy the endometriotic lesions because they start to grow. And with surgery, you have created a lot more inflammation, a lot more scar tissue, so it can be quite harmful with ablation. So surgical excision remains the gold standard, and the complexity in surgery comes because endometriosis would involve rectum, sigmoid colon, bladder, fundus of the uterus, and you need to be able to excise all these lesions.
I think also with excision, we not only excise the endometriosis, but a lot of the scar tissue that remains from downstream from endometriosis. And so it's twofold, that ablation only, you're burning those endometriosis lesions, but you're creating more scar tissue, but you're not actually excising the scar tissue, which is also what creates a lot of pain in these patients.
Absolutely. I think that paints a really good picture of it. I remember, when I woke up from my first surgery with you guys, I remember I was like, Dad, my stomach isn't tight anymore. And I was like, this is awesome. This is the first time I felt this in I don't know how long. And, I know I have a pretty complex case of endometriosis, and some of that too is where it's so important to find that specialist, because I had previous surgery with one of the big names out there that, it was excised and okay, life's going to be good for you now. And they had told me I was stage 1 at that time. And then 2.5 years later, upon consult, which is more money, was, oh, you shouldn't need surgery. We already treated this. You were only stage 1. It shouldn't have, which led me to you guys, because I was like an 80-year-old woman laying in bed all the time and, using to walk. And after surgery, I was diagnosed with you guys with stage 4. And I think a lot of the questions we got too, once again, that's case by case, it seems to be such an aggressive disease for some. And they wonder, is it worth it for ablation? And I always tell people, just say, find these diamond in the rough gem surgeons that are out there. They may not have flashy names above their things and, all of that social media aspect, and I've loved watching you guys grow, but it is definitely worth it to go forward with that excision. And I think another common misconception that we've talked about a lot too is that, personally, I had to go to the choice of hysterectomy with the severity of my disease, but it's not a cure. It's not only a reproductive disease, and it can come back. So could you speak to a little bit about some of the extra pelvic endometriosis cases you've dealt with?
The most common extrapelvic endometriosis we will find is on small bowel, on appendix, on large bowel, on diaphragm. It could be on liver, spleen. Bladder is still pelvic. When we talk about pelvic organs, we talk about pelvic being, uterus, fallopian tube, ovaries, sigmoid colon, rectum. But sigmoid colon, when it's outside the pelvic rim, it's often involved. Appendix can be involved in about 4-5% of the cases. Diaphragm is definitely one organ that we carefully look during surgery. Mm-hmm. And not to mention, it could be present on omentum and small bowel. Spleen, yes. So during surgery, it's really important not to go back and forth, means not to have partial excision, and be able to have one surgery where you can excise, whether it's pelvic or what I call extra pelvic, means outside pelvis, to be able to handle.
Then skin.
Obviously, we'll find subcutaneous tissues under.
I had a patient who had her period through her abdominal incision every month.
Wow.
Yeah, she would wear a pad in her abdomen, so we took her back and excised it. It's all subcutaneous endo.
And I think that's something too, that when we're trying to take away some of the stigma and get recognition on what a severity of disease of endometriosis is it's full body chronic inflammatory, and I think a lot of times women start to get in their own heads. I know I do. I've looked at my surgical reports from you guys, and then I'll call you and be like, I can't be back, can it? Like, am I going nuts? And you guys are like, no, it's very real. You know your body. And I think that's something that's been so validating with working with you guys as well, is that validation that you get because you understand the disease so much. Family, friends, people who don't fully understand the disease, sometimes they'll get, well, you've had a hysterectomy. You've already had surgery. Like, what's the deal here? And it goes back to talk about we don't have enough treatments to be able to treat the disease itself. A lot of it ends up being symptom management. And that was another thing that attracted me to your practice, and something else that a lot of people were asking questions about when I shared we were going to do this collaboration is, what are the other ways besides excision surgery that you guys have found to help manage women's quality of life with endometriosis?
I think one big thing is immunology, immune aspect of endometriosis that we really don't talk about. I think a lot of patients who have endometriosis, they have other immunological issues also. They may have irritable bowel issues, they may have thyroid problems, they may have other autoimmune diseases, and it goes hand in hand. So coming back to the medical management of endometriosis, I think either it's pain management, that is taking ibuprofen and Motrin. There are two different medications which are approved by Food and Drug Administration. One is called Orlis and second is mifenbrine. Those can be used for up to anywhere between 6 months to 24 months, but they are not without side effects. I would say about 30 to 40% of the patients may discontinue the treatment because of side effect. Other taking Lupron, IUDs, these are all symptom management really, without addressing the underlying problem. Birth control pills can be helpful, but again, they can decrease some pain, but they don't really decrease underlying endometriotic lesions. Coming back, this is such a huge disfavor as a physicians and medical practice that we have not invested in research and development for medical treatment. And I think a lot of what I would project and predict is over the next few years, we will see a lot of immunotherapy. Like we have checkpoint inhibitors, we have a lot of immunotherapy for cancer drugs, cancer, ovarian cancer. We will see a lot of immunotherapy treatment coming out in the future without having to undergo surgery again and again. But as of right now, there's only pain management using GnRH analogs or such as antagonist or agonist. Right, Orlis, Lupron, or mifenbrine. So the treatment is rather limited.
But I also think it's important to point out, even though you have excision, then a lot of times our goal is you still may need medical therapy after excision to prevent the progression of endo. So even though we do an excision, a lot of times then we'll put patients on an IUD, sometimes in combination with birth control pills, because the goal is really not to have a period, because the period is going to do nothing but progress the endometriosis.
Absolutely. And I've gone a similar path with you guys. And, that was something that set you apart in my mind from other doctors I've consulted with. And when I say other doctors I've consulted with, I searched all of upstate New York. I was from Ithaca all the way out to Albany, Buffalo, Rochester, every larger city here. And I never found anybody that had the thorough understanding until I found somebody in a support group who's also one of your patients, Megan. I did my first, Friday highlight of Endometriosis Awareness Month towards her today, because she is such an integral part in my journey, because she led me to you guys. And I had never had anybody talk to me before about the importance of, in the middle of our consultation, saying we're going to do surgery because it's very necessary, but we also are going to make some other adjustments after the surgery too. And I think that's huge, is because a lot of times when you go to a surgeon, you do that follow-up appointment and then you're back to your general GYN and that's it. You guys really look at the whole person, the whole care. I saw a comment come through, what about diet? Yes, absolutely. And that's something that I've talked with the doctors about as well, is doing research on low inflammatory foods. Personally, I've had to cut out gluten. Low impact exercise is something, some supplements that I take. It's almost like, and I go from the therapy side of perspective, you look at things and think of things of, there's a lot I cannot control about this disease, but let me empower myself to do the things that I can find to control and minimize my symptoms. So, I was openly posting about, I was having a pretty rough flare the last few days, but I made sure to do the things that I knew that helped you get through that. And until we find a cure, it's amazing to hear on the horizon some of these immunotherapy approaches, but it's so important to figure out those things that you can control to help your health.
As an oncologic surgeon, when I do surgeries for ovarian cancer, and that's where my journey, because the cancer would grow on bowel, bladder, diaphragm, spleen. That's where my transition into endometriosis was quite remarkable, being able to do surgeries that are very similar to cancer operations. And I talk about endometriosis is not cancer, but it grows like that. And in fact, I think endometriosis is worse than cancer because of not having any medical treatment, not having any subsequent, immunotherapy drugs that would completely eliminate or cure. So even after surgery, that's where thoughts are being able to medically managed. Because if you do nothing, for example, most of the surgeons, endometriosis surgery done by, we don't know anything about it, all with your OB/GYN doctor, it's not good enough, because you still need medical management, you still need optimization of the immune system, you still need optimization in decreasing inflammatory process that goes after surgery. That's where we focus a lot, not just surgical aspect. Even after surgery, we want you to be healthy, we want you to not come back to us again and again for surgery. That's really not the goal. So immune system really plays a big role. Medical management to decrease the risk of reoccurrence is really vital, whether it's diet, whether it's supplements. There are a few supplements that we prescribe to all our patients, and we really monitor them carefully even after surgical excision. I think the best advice I can give to everyone, be the best advocate for yourself. Don't settle for substandard treatment because of the insurance, because of the financial aspect. Get the best treatment.
I think to kind of give the viewers an idea. So when Dr. Singhal, as a cancer specialist, does a debulking, we go in and we basically open the belly up and remove every bit of cancer we can, meaning take it off the bowel, the bladder, the spleen. And because he has that skill set, that's also our approach with endometriosis. We go in and we remove endo from every single place that we can possibly see it. And then obviously want to do surgery afterwards. Do medical management afterwards. When we started this journey, we started seeing some endometriosis patients, and it kind of has escalated beautifully since then. But we've had people reach out. We've operated on patients from Colorado, Alabama, Mississippi, somebody coming from Canada, and it's really been a humbling experience for us, and also rewarding that we can help these people that have really struggled so much and have not been able to get the care that they needed.
And I'm not saying they need to come to us, but be your own advocate. Don't settle that this is just period pain, and don't settle for less. Don't go to.
Perfect. Thank you, doctor. You would think after 3 years of COVID, we wouldn't have any more tech issues, but they still arise.
So I think we were talking about being your best advocate and not settle for less, and that's really, I think, the best advice I'll give everyone. Any treatment, particularly to endometriosis, because not many people understand biology, not many people understand the disease or surgical treatment.
And that's so true. And it's one of the frustrating parts as a patient with endometriosis is like, why was it me researching and fighting for 13 years and saying something was wrong with me, something's wrong with me? And I find a lot of times too, the people that I connect with in support groups run into those same experiences of they feel that they're explaining endometriosis to their general GYNs, or the general GYNs are still saying, oh yeah, you'll have no problem after you're pregnant. You'll have no problem after a hysterectomy, and all these unnecessary procedures or just misleading procedures. So one question that kept coming through, if you could attest to as well, what would be some good questions for people to ask their doctors to make sure they're with somebody who can handle their care if they are able to make it to people such as yourselves or some of the big advertisers that are out there for endometriosis?
I'll answer this question in two parts. The first part that you brought up, that patients take about 7, 8 to 12 years to get proper treatment, and the reason being is, and it took me a long time to understand myself, is it's very common. There's a lot of pain, discomfort, pain during menstrual cycle, and they have ultrasound which are normal. They have MRI scans which are normal. They have CT scans which are normal. And most of the physicians, they see care is everything normal, there's nothing wrong, it has to be in your head. And that keeps delaying treatment for years and years and years.
Mm-hmm.
Now, and the reason being is this imaging studies like ultrasound, MRI scan, they actually about 60 to 68%. So endometriotic deletion, if they're really small, for example, 6, 7, 8 millimeter implants, you may not see on ultrasound, you may not see on MRI scans because the resolution is so poor. And they keep getting diagnosed with everything is normal. It must be you who's seeking this pain treatment. So that's what I think causes a lot of the delay in treatment and diagnosis and treatment frustration. Now coming back to you about the treatment, if I'm the patient, the first thing I ask myself is, for example, I need back surgery or gallbladder surgery or any surgery. I normally call the operating room nursing staff. Hey, listen, who's a good surgeon?
Who do the nurses
Who the nurses go to? And I have that ability because both of us are physicians. We can make those phone calls for patients. They don't have that ability. Everyone looks great on social media. Everyone looks great on their websites. Everyone looks like the best thing after sliced bread. So it's really important to ask questions to the physicians, like how many surgeries have you done? What is the experience? What else do you do? For example, I don't clean house. I don't change electric bulbs. I don't know how to do it. All I know how to do is surgery. That's a fact. I can't.
Well, you
I can't change electric
you can
bulbs.
change a light bulb.
I can try. But
How many surgeons does it take to change a light bulb?
Yeah, so Leslie, I want to keep told them, but we're actually partners in practice and partners in life, and so it's.
So coming back, it's really important to know how many surgeries they have done. What else do they deliver babies? Do they do, all this regular gynecology stuff?
Mm-hmm.
So it's really how much time they're spending on this disease process and how many surgeries, what cases they have done. Talk to their patients, look at their outcomes, look at their testimonials. I think that's really important because more surgery, the more harm it can cause, especially if you do improper surgery. It makes it even harder.
So just a little information about our practice. Dr. Singhal and I are both surgeons. Obviously, he's gynonc and I'm minimally invasive, but we do about 20 surgeries a week, and we probably do at least, 5 endo surgeries a week. So we're surgery only, and that's where Dr. Singhal was getting at. All we do is surgery. All we do is focus on surgery, and we're a very high volume surgery practice. We operate together. We take care of the endo patients together, and so it's very much a team approach for both.
It's not about us, it's about patients and being the best advocate. Ask the questions, what surgeries they do, how many they do often, what is the experience, what the training is, and do they really understand the disease. I would not go to some general surgeon who does everything, but focus on one disease process. And ask patients, look at the questions, look at the answers from other, family, friends, and then see the treatment. Surgery is such personal treatment because once you have the surgery, I call it you're married to that patient. You really have to help through the process, not just surgery and get done. Don't come back and see us. So again, be a best advocate, ask questions. If you're not satisfied, don't undergo surgery, and look for how much volume, what experience they have. Can they handle bowel surgery? Can they handle bladder surgery? Can they handle, urological surgery? Because I have seen often there will be surgeon gynecologists doing surgery, then they have a colorectal surgeon, they have a urologist, they have a thoracic surgeon. You have 4 or 5 surgeons, and the surgeries can last 6, 7 hours, and nobody's taking charge because you have 4 or 5 chefs in the kitchen. Then it creates more misunderstanding, more miscommunication. Nobody's in charge. Nobody's taking responsibility for the total outcome. So I think that's all I can say. Be your best advocate.
And I think that's such wonderful advice. And like, I always, I relate it back to the mental health side of things. Like, that would be like for somebody to say they're an endo specialist, which you run into often, that would be like me as a therapist. Right now, I'm currently working in school social work, saying, yeah, let me offer you EMDR because I took a 3-day training on that. Yes, I can do it, but I shouldn't be doing that as a specialist. So I think their advice is wonderful in asking those questions. Are you able to handle, my suspected care if we got in there? Because I know that was one of my first questions I asked you. Was I was worried about my sciatic symptoms, and they found the sciatic nerve was completely pinned down with endometriosis and with the scar tissue surrounding it as well. So, and I think too, like, so many of people who live with this chronic illness end up knowing a lot about it, and because you live it all day, every day. And that's where it's amazing to have surgeons like you that when you come in and say, I'm experiencing this, you're not saying, I think you're med seeking, or, oh, you know more than me. You're like, no, I believe you because this is what most of my patients come to me for. And it's just been such an ultimate pleasure to have found a practice that is expert, looks at you as a holistic person instead of just seeing you on their surgeon table, and also taking that next step in advocacy, in wanting to see more research growth, in just wanting to see the best for the endo community and justice within the community so that endo excision is accessible. And you guys are taking amazing steps in getting to that direction. And I personally have reaped the benefits. And that's where I wanted to make sure I invited you guys on during Endo Month for advocacy, to make awareness to you guys. If you are in New York or close space, and like they said, people are coming from Canada. It's a different country.
We got to call from Canada and Boston.
Guys get results, and they deserve the recognition that they get, and these are two of the most humble people I've ever met, and they would never do this by themselves and brag about it. Here I am to brag about that.
I don't even know how to use Instagram, so
He's learning.
No. Leslie, I would also point out, it's such a shame because there's so much awareness on ovarian cancer, so much awareness on breast cancer. There's so much. I mean, if you think about, there's about 23,000 ovarian cancer diagnosed every year. When we talk about breast cancer, maybe about 200,000 per year. But endometriosis, there are millions of patients, millions of people who suffer, and there's zero advocacy at the Congress level, at the state level, at the federal level. There's no funding.
More, but it's not.
I mean, it's a shame.
It's primitive compared to what we see.
It is, and so much of the time too, and I know we've had these discussions as well, it's actually really funny. Dr. McLean has to keep us on track when I go in for surgeries in the mornings because Dr. Singhal and her and I all start talking about all of these little side note kind of things. But one of the more recent things of frustration on top of a lot of them with the disease is the money that's allocated is allocated to that early diagnosis and fertility. So both things are so important in endometriosis world. But how about the people who have lived with it that just need their treatment managed, that their goal is not fertility? It's almost like, okay, we have so many women that have lived and were not diagnosed early, have lost fertility, and what about them? And all aspects are important, but your point, it's you see breast cancer walks, you see ovarian cancer walks. It's rare that you see this for endometriosis, and I think
see that
more, but it's not nearly enough. And these people are out here doing the same work that I'm trying to do and bring this light to them. And I know this will not be our last collaboration together.
Thank you so much for doing this and raising awareness.
Yeah, and I think those are our aspirations as well. I mean, like I said, we're a new practice. We've been now 2.5 years, but our goal as our endo business is continuing to expand, and we want to increase advocacy, and
I think we would like to bring, as you and I, we talked about not-for-profit, that we can raise money, awareness, research development. I think the biggest advancement I can see, and I would predict, is going to be immunotherapy for endometriosis. We never talked about what really happens to T cells and B cells at the site of endometriotic implant. I think that's where a lot of the immunotherapy is going to hold as long as we are able to find federal level funding or even raise awareness at Congress and state level to provide funding for immunotherapy research.
And it's huge. And just, I'm so excited about our partnership moving forward as well. We have a lot more than just an Instagram live
Yes.
planned to kick off Endo Month. So please stay tuned on both of our accounts for anybody who's watching this. We will be posting this later for those that were not able to log on at the specific time. This will be archived and the content will be able to be shared on both accounts. And keep watching out for the things that we have coming, because I'm really proud of the work that each of us are doing solo, but we have some really awesome things coming from both of us as well, well past just 1 month of awareness. So
Yes.
Thank you for helping me kick this off this month and your time.
Again, ask questions, be your best advocate.
Absolutely. I hope everybody took that away from today. That's kind of my biggest thing always as well. But thank you for your time, doctors, and everybody have a wonderful day and take care of themselves today.
Great weekend and thanks.
Bye, guys.
Bye-bye.